So without any further ado, I'd like to kind of give you a brief background how the climate change came about into CNMI and how we became part and members of this climate change adaptation. So I wanted to kind of also showcase the BECQ, the Bureau of Environmental Coastal Quality, which is the organization that manages the climate change in the CNMI. And they were the same agency that worked collaboratively with NOAA to come up with the vulnerability assessment in Tinian and Rhoda and in Saipan back in the year 2015. So there, I just wanted to kind of briefly show you our geographic setting. I used Hawaii because we're doing it here today. So CNMI is located approximately about 3,800 miles southwest of Hawaii, 130 miles from Guam. And CNMI is also about 6,000 miles southwest of the west coast of the States, United States mainland, and about 9 to 10 time zones and a day away from Washington, D.C., depending on daylight savings time. If I said that correctly. So CNMI consists of 3 islands. We have the Saipan, Tinian, and Rhoda. And from 2010 US Census data shows that Saipan has, being the largest population, has about 48,000. Tinian, 3,000, and Rhoda, about 2,000 more or less. And CNMI gets an average of about 450,000 tourists yearly, mostly from Asian countries. And tourism is our way of economic growth in the CNMI. So with this information, I wanted to kind of showcase this as a result of our initial discussion and meeting with the Resilience Working Group. So this is a collaborative effort that we all put in together. And one of the questions that was brought up by some agencies was why adopt? So we thought this information we could factor in to be able to move forward and fully try to implement this climate change adaptation in the CNMI. So as everyone here in the Pacific, we rely heavily on our environment as our livelihood, survival, and way of life. Clean and healthy environment. And the community, infrastructure, and ecosystem may be adversely affected through small rise in sea level and changes in rainfall. Ultimately, preventive planning can protect and enhance the well-being of the people and build environment of the CNMI. So I've asked BCQ to kind of give me some timeline as to how far they have gone and how far we're progressing. Are we really progressing or not? So I think this timeline would probably give you an idea. I mean, I don't even know if we are really progressing. So climate change actually in the CNMI started out in year 2011, and this has been going on for 7 years, but we hardly hear from our own local government about implementations and other activities that could, potentially fully adopt climate change in the CNMI. So year 2012 and 2013, community workshops and meetings were held, and unfortunately, the hospital was not invited to those meetings and workshops. So 2014, the late Governor Enos issued a directive order in support of the climate change working group. I can only remember vividly of that event. And then 2015, the vulnerability assessment were completed. And then in 2016, the Climate Change Working Group renamed into Resilience Work Group. This was the same year when we became officially a member of that Resilience Work Group. And this is because of, again, when we were trying to apply for this grant. And I had to reach out several government agencies as to whoever might be handling climate change in the CNMI. And then 2017, our governor, again, issued a directive order in support of the effort. And I think this is one way to kind of revive that initiative because it kind of died down So I mean, thankfully that just recently it was revived again, and I believe this effort was made last year, June of 2017, during the 29th Pacific Environmental Summit that was held in CNMI. And several groups from NOAA, EPA were invited to do a presentation along with Dr. Mike Kime. So again, the plan was for 2018 to initiate all meetings, adaptation, dialogue, and discussion with the working group. But honestly, from the time it was issued, the directive order last year, we haven't really met, unfortunately. And just recently, the chairperson that was appointed last year had to kind of step down because he was moved to another department. So what does that leave us again? And it seems like it's going to go back burner again. So sad. So again, during our discussion, one of my question that I actually asked to BCQ, how did this resilience working group came about? And knowing our setting in the CNMI with the less funding, I mean, it takes funding from federal to really kind of implement something and for us to do something. And I think Department of Interior provided that technical assistance funding to develop an adaptation plan for the CNMI. And I believe this was back in 2011. So from the last time that they issued that directive order in 2017, the governor, through his designee, appointed BCQ again as the agency to spearhead this effort, along with the governor's office. So the resilience work group came about as a byproduct of that climate change working group. So again, part of the discussion that the group had was, in order for us to develop a plan, is to kind of come up what is really our main objective. Our objective was to develop a long-term adaptation plan for changing climate, and development process should involve participants from different sectors of the government. Truly, we have different sectors from the government on that group. And as Julie had mentioned, and I was just talking to her earlier, when we had our first meeting, when we were formally introduced one another to kind of showcase what we do in our department and how can we contribute towards this adaptation, our state epidemiologist asked some of the members, could you provide us some data for analysis and all that, and what kind of data do you need? And our epi says, what do you have? We have this data report. So it was really funny when I was listening to her because we were in that same mode last year. It was just so funny. But it's a good thing that, our epidemiologist, he's British, actually. He used to work for SPC, and he has a good way of trying to engage with the community. At first, he thought he was not accepted by the community because of his, not necessarily because of his color, but I guess more like intimidated, his accent and all that. But now he's really doing good on the island. So the whole purpose behind the Resilience Working Group is to shift that focus beyond vulnerability and start the process toward adaptation. So how do we accomplish that? Again, during the discussion, we all came up with this information, with all this exchanging of ideas, sharing of information, that I think we should use vulnerability assessment for the island of Saipan and Tinian to be part of that in order for us to develop a good plan and then consider impacts in future project development. This is something that everyone kind of brought up a question on the table, like impacts on future project development. We have the CNMI Homeland Security Office as the emergency management office for the state. So as CHCC, being part of that stakeholder, our response is, primary response is ESF 6 and ESF 8. And we are required to, every 5 years, to update our emergency operation plan. And sad to say, our state, our all hazard plan is still in a draft mode, and it hasn't been really shared to us, but we have to come up with our own. And our own emergency operation plan should be just an annex or an appendix to the state plan. But we're all doing it as a all hazard type, our emergency operation plan. So part of the sectors of this plan that we will highlight, and all these 5 sectors is through different agencies. In the CNMI, we have the natural environment as part of the considerations, the infrastructure, public health and healthcare system, economic resources, communities, and cultural resources. So before I kind of showcase this photo here, I wanted to kind of briefly discuss about how we became part of this resilience groups, and with the small funding that we received from ASTO, it was really helpful for us to fully understand, and pretty much we align our activities with the initiatives. And I am an emergency preparedness coordinator, both public health and hospital. And then about 3 years ago, our CEO delegated our director to manage the ELC program, which is the epidemiology and laboratory capacity. So all of these activities can be aligned. It's all about infectious disease surveillance. It's all about part of the climate change, for all we know. And it's just that we don't really know the impact, how it starts. I mean, everything, again, boils down to climate change. So the BRACE funding, we received it 2017, January to June, 6 months period. And then it was extended because we had to spend it down. I mean, it's funny because it's so ironic. At 50,000, we couldn't even spend the whole money just like that, but we needed money. It's just that we're trying to kind of envision how much more and what we could do to fully address and satisfy the requirements of the grant. It talks about resilience, BRACE, building resilience against climate change effects, public health. So that funding helped us to be able to kind of sponsor this meeting to formally meet all the members of the resilience working group and be able to show what their capacity is. And because we don't know what they have until we all sit down and provide some information. And again, our epidemiologist here, Dr. Paul, Dr. Paul White, he was doing some education with regards to our surveillance activities. And as you can see during that time also, he did some education on our initiatives as part of the CICA funding. So we've had our EPI, our doctor here, and Jan Tiger-Bell, who's supposed to be here, our environmental director, and the whole team, preparedness and other stakeholders. So it was a very exciting discussion because a lot of people kind of try to ask questions how important all this are affecting our public health by the end of the day. So part of that BRACE funds that we received, we were able to also go to Rhoda, and we haven't scheduled Tinian, and he did some education on climate change impacts on public health. Again, we've got good presentations there. It was attended by some community members, other government agencies, and some private citizens. So these are all part of the BRACE fundings that we received. And another accomplishments that I would say, although it's still on a draft mode, was we're able to come up with the public health assessments on impacts on climate change. And just recently, with the second funding that we received, it allows us to get GIS software mapping. So this is an ongoing right now, and there's going to be training to be conducted to kind of train some of our staff. And actually, next week, there's going to be another climate change summit through ASTO. This is going to be next week in this same very island. And I'm supposed to be in that summit as well, but I couldn't make it because of the conflict of schedule. So I think this concludes my presentation. Again, I want to thank the organizer for allowing me to be here. I've learned so much. Scary, but it's the reality. Thank you.